Hi, everybody. Welcome to today's Career Chat. I'm Krista Harmon. I am one of the career readiness consultants with the Kent Intermediate School District. And we have a patient care assistant. Her name is Andrea Spiegelmoyer as our guest today. Welcome, Andrea.
Hello, thank you. This is awesome.
So we're so glad to have you here. And one of the things that I know students like to hear is what you were thinking back in high school. Let's start there. Did you think you would end up as a patient care assistant? And actually, Andrea, before we even do that, why don't you let students know what a patient care assistant is?
So basically, it is a patient care assistant, and we are like the assistant to the nurses and the doctors. We just help in any way that we can to help facilitate care for patients in the hospital setting.
Awesome. And we'll look forward to digging into that further.
Yeah.
So when you were 16 or 17, did you always thought you go into healthcare? Is this the job you thought you'd land? Give us that early career path.
Since I was 5, actually. My mom's an RN. My father also works in healthcare. I just always knew healthcare was where I was going to go. So it just, the fact that I found this job is a great stepping stone. If you don't want to make it your full long-term career, it is a great stepping stone to get you into healthcare farther. So it does also allow you to learn different parts of the hospital, different procedures, like what's going on. So you know what direction you do want to go. And when I was in high school, it was the only way I wanted to go. So I guess I was lucky with that aspect, but.
Yeah, that is nice when you have some people in healthcare that kind of were paving the way a little bit for you. So tell me why you decided maybe not go into dental care or, to be a technician in radiology. How did you decide on patient care specifically? A PCA?
So I'm just love working with people directly. And I love being able to see something start to finish, which is actually kind of funny that I'm in emergency because you don't see that full finish, but you do get to work with that patient when they are in like their most time of need. And that's really something that was my drawn to. I want to care for people, and being an x-ray tech or a dental hygienist, yes, you still do care, but I wanted a little bit more in depth into it. So just wanted to really get to know someone as much as I could in a short amount of time.
And that's important for young people who are on the call to start doing some of that self-assessment of what part of healthcare, how involved they want to be with the patients versus not. And this is what these are so great for, right?
Right, because you can be totally in the healthcare field and you might not ever see a patient, and that's okay. You're still helping them. You could go to the lab and be in the lab and you're still helping get all of their levels, but you don't have that patient contact. So that is definitely something to decide on.
That's great. So tell us about your path then to become one. Do you have to have a certain certification, education? How do you get into be a patient care assistant?
A lot of the hospitals, at least in the Grand Rapids area, do like to have you have some experience or have been in college courses already, but not all. You can do a certain certificate course, which is get your CNA, which is a certified nurse assistant. And you're able to do basically what I do, but you could work at a nursing home. You could also work, you could come into the hospital then as well. And then that already gives you that experience. So you're a more hireable candidate. And then, but when I started probably 15 years ago, I didn't have to have any experience. They gave you all of that at the hospital as you were training, and then you kind of worked your way up, because a lot of hospital systems have 2 different levels of what you do. So you would start at the level 1 and then you'd work your way up to level 2.
So give us a little more detail of what that means then. Give us an example of what your typical day might be for a level 1 versus a level 2.
Sure. So level 2 basically just means you're going to have additional skills. So both jobs are pretty much going to start off. I can speak to the ER mostly. We're helping check patients in. We're getting all their vital signs. We're helping get them to the designated room that they need to go to. We're helping them get changed into their gown, get ready to be seen by the physician. The physician will see them. We just help the nurse gather supplies. Anything the physician wants to do, we gather those supplies. We also will transport patients from point A to point B. So it could be taking them down to x-ray to get an x-ray, could be taking them to CAT scan, could be transferring them up to their admission room. And then we just help get them settled in with all of those. We're just another advocate for that patient, another set of eyes, because it's crazy. Let me tell you, that ER is a crazy life. And it's the same thing on the floor. those nurses are spread thin. They can't keep an eye on their patients if they're in another patient room. So you're just that other set of eyes, and that other voice for that patient. And then
yeah, sounds like a critical part of the team for sure.
Definitely, like you are relied on a lot, and it's a very fulfilling job to do. As to like level 1 and level 2, at the hospital I'm currently at, there's not actually a different levels, but at other hospitals, it's just adding in things like a sterile technique and being able to do EKGs. And there's just certain things that and every hospital system is different. So I don't want to misspeak to other hospital systems. But there's just different levels of, you have to have extra training, which is why you start at the bottom and then you work your way up.
Now, you had mentioned a little bit in our pre-conversation that this patient care PCA at the hospital you're at can also be called other things at other hospitals. Help the young people understand what some of these roles are called.
So we are a PCA, which is a patient care assistant. I do know at other facilities, they're called just a nurse assistant or a nurse technician. Those are about the 3 that I know of that you could be called. So they are definitely different titles depending on where you're looking to go. Basically, you're just looking for some type of an assistant role when you're looking for job titles. And it'll tell you right in the job description, you are assisting. That's usually a good keyword for you, is that you see the word assisting a lot.
Right. And it's my understanding that, and at least I know Mercy Health and Spectrum Health here in town, and I think Mary Free Bed too, you don't have to have any formal training before you become a PCA, that you have to be 18. That's one of the requirements. But what else do you know then as far as those entry-level positions for young people who might want to get their foot in the door this way?
Usually in healthcare, you're going to have be at least 18 years old. You're going to have to either have your high school diploma or your GED. They do want to have that. That is pretty solid. I am finding more and more though, that they are wanting you to have your CNA, or you're going to have like a semester or 2, like within some type of nurse clinical, have some type of clinical experience. They want you to have a little bit of background knowledge coming into it. I do know that CNA role, it's a certificate that you can get. And I know a lot of people can do that in like 6 months to a year, I believe. Don't quote me on that, but I do believe that's the case. But yeah, I mean, just kind of like a basic knowledge it's going to give you a lot of extra. And this here is good skills too, because you're going to know what direction you want to go with it. And do you guys have like classes and stuff they can take there?
Yeah, that's what I was going to give a little plug for our programs. So the Kent Career Technical Center, you guys, is one of the programs of the Kent Intermediate School District, where I'm from. And it is a program for juniors and seniors, and it's located off the eastbound line. And students from all over the county come to do one of the 28 programs that are there. And one of the programs we have is medical assistant. We have emergency medical technician. We have a pharmacy technician, and we had CNA, but I'm wondering if they have CNA and medical assistant, or they traded that out. So I'm not sure.
They're similar.
Yeah, it's a 2-year. You can go as a junior or senior. You could do one program, then another one. It's free. Your school has busing out there. And so thank you. CNA is still at KCTC. Thanks, Amanda. I was just going to an open house next week to get caught up on their new programs. So what's great is the training is free to you. And then you can sit for the state test. And then you have your credentials. Also, I know that many nursing homes are willing to pay for your CNA if you get hired in as a resident assistant, for example. And these are entry-level positions again, and the nursing home pay for that training. So don't pay for that training out of your pocket right now. Yeah, in today's world, employers need you, and they're going to pay for that training.
Especially right now with this pandemic, we need all the help we can get right now. So
great. And Faith, I'm just pointing out that you can only do the CNA as a senior. Yes, I know those are some of those changes I have to learn about. Thank you, Faith, for giving us that information.
Yeah, because if you guys do that your senior year, you're ready to go right into the hospital system, and you have that CNA already, which is going to put you above people who don't have it. So that's awesome. That is awesome. I wish I knew that when I was in school.
Yeah. So if you are a freshman, sophomore, or junior, please talk to your school counselor about KCTC, and find out what your options are for sure. So give us a typical day, if there is one, Andrea, of what
Yeah.
your day in ER might look like. And again, there's PCAs in every department in the hospital, right?
Correct.
And did you
Correct.
start in the ER or did you find your way there after some other departments?
I actually started the resource pool. So depending on what hospital system, it's resource, it's staffing, it's different titles everywhere. But basically you are a floater. So I did start in that first. And then I kind of already knew I wanted to do ER. That's where my family kind of has always worked. And I had some friends down there. But I did want to try the whole hospital. And so I figured out, yep, ER is what I wanted. But there's people who try it and they decide ER is not what I want. So if you don't really know what direction you want to go, getting into that resource pool is really helpful. It's also really, really good if you are going to continue on with your schooling for college, because it's a very, very, very flexible department and you can just kind of pick and choose when you work. So that helps a lot as well. But you get to know the hospital really well and you know what direction you want to go. So as to a typical day though, we'll try to keep a typical day here. I work 7A to 7P. So my mornings definitely start off a little slower, which I enjoy. It gives me a little bit of time to wake up, get some things stocked. So basically we all get like a department within a department that we are responsible for. So I pretty much start in the morning, stocking everything, making sure everything's clean, stocked, ready for that next patient. I want to make sure all of our equipment is in the room, that we have gowns, we have enough blankets, we have enough cords for the monitor, we have all the blood pressure cuff sizes, all the computers are working, that all of our equipment that we need for that day, for when we do get busy, which could happen as early as 9 a.m. and it could happen at 1 p.m. And that part we never can predict. So we want to control what we can control. So once I have all that going on, then I've also made sure that our blood sugar machine is up and running so that we're good to go on that. Once all the rooms are stocked, at that point, it's just helping the nurses. We go through and I do a lot of vital signs every day. So you'll definitely get to know your highs and lows on your levels that way. You'll get a lot of skills with that pretty quickly, especially in the ER. You do a lot of vital signs. And then pretty much the transports start amping up at that point in time too. We're right about lunchtime. So now I'm taking patients from point A to point B, taking them upstairs to get admitted, cleaning the rooms when the patients leave. In the ER, we have housekeeping, but a lot of it is done by the staff because it is such a quick turnover. So you are also responsible for taking care of all of that. And then you have to just make sure that room is ready for that next patient as quick as possible because you don't know when they're coming in. That's pretty much my day.
No, it sounds like a very busy day and lots of variety. And that's probably what you like about it. And again,
exactly. Yeah.
To be part of a critical part of the team. Because sometimes young people will think, they have to be the surgeon to be in the surgical center. And there's so many support roles around it, right? And so just like you,
Correct.
You're in ER, so you're part of that action, but you're not necessarily the nurse, but you're just as critical to make sure all those things are stocked and everything.
Oh, very, very much so. And the doctors for sure, they rely on us a lot to know where all the equipment is. And so we use the term gophers. We're the gophers. We go for the product. And you learn the hospital too. Like you'll see me running the blood bank. Like you run on this job. You do.
Yep. I love it. Were you trained on the job then? Or
yes,
because I think a lot of the young people want to know, like, well, how do you know how to do some of that if you're coming in without a formal education? So let us know how that training went for you.
So you have like your hospital orientation, which is pretty standard for a few days. And then you have usually a few days unit specific orientation. This is all off the floor. And then you get onto the floor that you're going to work, and you're going to have 2 to 3 weeks minimum on the job with a partner training, and they're going to teach you how to do all of that stuff. And then it just all depends on how you are doing at that point. They may extend your training on, you may be done. I mean, when I switched from one facility to another facility, my training didn't last the full time because I already knew what I did. You have a competency checklist. They give you, every department will have that. No matter what hospital system you're in, you have to be able to prove that you can do what they need you to do. Once you're checked off, you're off orientation. So you hit the ground running at that point, but they do teach you everything you need to know on the job. But I can also stress this enough that it is constantly a learning job. There's always something new coming up. There's something that can't be covered in orientation. but you are a team and everyone there is there to help you. So you have to ask for help. Don't let yourself drown. This is not the time to just suck it up. Ask for the help. Everyone is willing to help. We've all been there.
I love that advice, Andrea. That's such a great career mentor thing to say, because sometimes our human nature wants us to like, oh my gosh, I don't remember that, and keep it to yourself. And that's not what the team needs. That's not what the patient needs. So I've heard that about healthcare. That's very much family-like, and that you can feel comfortable asking each other. What other little tidbits do you want to share about that reality of being part of a team?
Oh my gosh, I love it. So I do believe you guys talked with Cindy, I want to say last Thursday. She actually is one of my, like, me and her just click. So this is kind of cool. You guys have already talked with her and you guys know her personality. We do anything for each other. Like, you get those people that you click with, and even the ones you don't click with, you're still that family, and we still we watch everyone's back. You need help, we help you. We can tell by everyone's faces, even though they're all like this, we still know in your eyes when you're stressed out and you need help. And we will tap out too. It's totally one of those where, like, I can't handle this. You put your hand up, you tap out, someone is right there to step in, because guess what? You're going to do the same thing for them down the road. And it's a great sense of love. Like, it's just, you feel like it's your own family, because you're with them almost as much as you are your own family at home. You just learn how everyone works. You know how your siblings work, you know how your parents work, and you just mesh and work together. And it comes with time. It doesn't happen right away, but it's pretty awesome when it clicks. You have a really good feeling.
Sounds wonderful to have a team like that. So you said you worked 7 a.m. to 7 p.m. So is that 3 days a week then you work?
I actually only work 2 days a week. Okay. I am considered part-time. So at that hospital, what's really good is that even at a part-time, so they call them FTEs, and I actually don't know what that stands for, but basically it's telling you the certain amount of hours you have to work. So you can be like a 0.5, a 0.6, or a 1, all those different, that's just telling you how many hours a week you have to work. So at the hospital system though, as long as you are a 0.5, you get health benefits. You get all those short-term disability benefits. You get all that. It's great while you're going to school too, which is one reason why I took the job originally, was I was working towards a nursing degree. So for me, I'm able to get all those benefits of a full paying job, of a full-time job at part-time, and still be able to further my career in whatever direction I choose to go. So it's
wonderful. And do they have tuition reimbursement? Yeah, exactly. Do they have tuition reimbursement? Tell us about that.
They do. Yep. And every hospital system will have a little different way that they do that. You have to work with a company for so long before they'll get into it. And I do believe now Mercy Health had switched theirs up last year, so I do believe it's like $3,000 a year. Do not quote me on that, because like I said, they change that all the time, and with the pandemic, things have changed as well. But you have to apply for it first, and then you pay for your class up front, and then if you receive a certain grade or better, they'll give you money back. So it's pretty cool, because then it turns around and ends up paying for your next semester for you. So you do have to upfront the cost. But I mean, student loans, they help, and then you can turn around and pay it off. So it's pretty awesome that way to be able to further your career for free, and you're still earning your health benefits. It's kind of win-win in my book.
I really want young people to hear this, because, there's so many concerns with taking on a lot of college debt. And, who says there's a timeline that you have to do it within 4 years after school, after graduation from high school, right?
I'm 15 years out and I'm still working. So you never just don't quitting. Like, you just got to keep going, keep going.
Exactly. For some people, they like the idea of getting in as a PCA, getting a lay of the land, see what other roles, and then to start the school where the hospital is paying for it. So just young people, keep that in mind. You don't have to take all that debt on. This is certainly one way to get there. Tell us what one of your favorite parts of your job is, and what's the least favorite?
Well, I'm sure you guys can all have an idea of what my least favorite job is. So obviously we're taking care of a patient from head to toe, and bodily fluids and functions aren't always the prettiest thing to take care of. So I'm going to leave that at that. And I think you guys can use your imaginations. But my favorite part is actually being able to see that patient come in. They come in pain. They come in and they're scared because they don't know what's going on. And we're able to actually help them and you sit down and you have conversations with some of these people. Some of these people they just really need to connect with someone, and being able to be that person that they connect with, and seeing them come in from the beginning in pain and in questions and leaving with answers and not in pain and feeling a lot better and thanking. Oh my gosh, getting thanked is like your heart melts every time. You are there to take care of them. You're not there to get thanked. But that is one of those just heartwarming things. We all need to hear it. And when you do hear it, it's the best part of my day. It really is.
Yeah, I remember Cindy said that too on Thursday.
Yeah.
That's just getting those thank yous is
and that's not what we're there for. We're not there for that at all. But oh my gosh, your heart melts.
Yeah, and that's one thing I mentioned about the students. Some rules in healthcare, you have new patients all the time. There's some that you have the same, like long-term care. If you are a resident assistant in like a nursing home situation, you get to know your patients very
Really
well
well.
because you see the same people every day. So I guess this is also why I love having you on today, Andrea, is like to give a different perspective. Like you're in an ER, but then the same role is in a Mary Free Bed rehab hospital. It's in a long-term nursing home. What else do you know about some of the other places that you could do this work?
As far as I'm aware, I don't think they have any for home health, because that's usually pretty much like a nurse, or at least like an LPN or up. But yeah, like Mary Free Bed, they have them over there too. So you're going to work with everyone from stroke recovery, a lot of brain injuries, maybe someone that's like had to get their leg amputated. So you're helping them a lot, and you really are changing their life. And it breaks my heart over there, but that really is, those take a special breed, and I commend them, because ER is my breed, and we do the same thing. Like they can't do ER, so they do that, and I do ER, so we are allowed to do what we need to do. But they have them up on all the floors too. So you could be working in a NICU. If you really love teeny tiny babies, you could work in NICU. Helen DeVos Children's Hospital has PCA's type role there too. So you could go and work with the kids. You could work at the children's ER over there too. You could go to Mary Free Bed. You could go to one of the nursing homes or like an assisted living facility as well. And it just gives you, take an age group and you can find what you want to work with.
I think it's such a great best strategy right out of high school, and to kind of like for sure start there part-time. I mean, why would you not, just to make sure you like it before you commit a ton of money, in your education for sure.
Yeah. Yep.
I had a student that wants to know, when you lose a patient, when someone passes away, how does that affect you? How do you cope with that?
So you learn to grow with thick skin, but that takes a while. It is a stressful thing. You have to learn to kind of leave it at the door. As much as we say that, it doesn't happen. You just over time, it's a time thing. So having that family aspect at that hospital, it really is what helps. We'll tap out. We'll go take a 5-10 minute break. Sometimes you have to go to lunch early because you're just like, I need to decompress, and you need to step away. You get off the unit, you do your thing, you come back. You are a better worker if you've been able to clear your head. And so they will help you do that. It takes time. It really does. I can still remember the first time I lost somebody. I went to the break room and I cried. We've all done it. We will all do it again. Don't be ashamed about it. It's your feelings. It's how you feel. It's a human life. Like, you are allowed to be upset and you are allowed to cry about it. And that is okay. And you will not be the only one. Just know that you are not the only one. So it is okay. Just make sure you take that time for self-care and self-healing. And you need to step off. Yeah.
I think that's such great wisdom, Andrea. Thank you. Thanks for asking that question too.
That was a good one.
Yeah, because it's real,
yeah.
If you
Most
were
people
to
don't want to touch that topic, and no, that's real. I like that.
Exactly. So we only have 3 minutes left. I'd love for you just to, again, give some young people some insights. If you were to do it all over again, would you do anything differently? Anything you recommend to them to be doing in high school to prepare? What kind of insights would you like to give there?
I definitely wouldn't do anything differently. Like, I 100% love that I found this job, and I thank my mother. My mother definitely got me into this. She's been an emergency room nurse since before I was born. Well, she was a flight nurse first and then transitioned to emergency room nurse. So she's been there. She got me into this, and I thank her every day for it. I would never not do this. Definitely take advantage of that KCTC option, because let me tell you, that's going to get you that in real quick, and you're not paying for that cost, which helps a lot. And then you can start right and go. So if I were to do it all over again, I would probably look into that. That would probably be the only thing I really would do different. Make sure you just figure out what direction you want to go. And like I said, you could do that resource pool as well, and you can figure out what direction you want to go that way. But if you know you've got the heart to want to take care of people, come join me. It's so much fun.
I love it, Andrea. Let me share my screen. I'm going to give a resource to the young people. Andrea, your last question will be in just a moment. You can give your final word of wisdom to these young people.
Right.
So you can think about that as I share this out.
Sure.
Young people, if you want to do a little more research about this career, remember, and if this is your first time, please know that this is called onetonline.org. And it's a fantastic government website that has all the information you can imagine about careers. So you would just go up to the right-hand corner there and put in a patient care assistant. I put that in, and actually what came up was nursing assistants. And you can see here that there's, went away. That there's all sorts of other job titles too that are very similar. You know, the CNA, the nurse's aide, nursing assistant, patient care assistant. This is the lingo. So it's going to give you a little inside scoop on that. And again, it gives you some ideas of what those skills are, what the job opening is in Michigan, how much money they earn, what kind of personal values you might have, what their tasks. Love this website, you guys. Such a great research.
I wish
tool.
I knew about that like 15 years ago.
I know, you can go back to it and see if there's anything else. But they really do give such a good overview. This is Andrea's email address. If you have any questions you'd like to ask her after today's career chat, she's been kind enough to offer that to you. So go ahead and write that down. And you can also email me, and I can get it to you if you don't have your pencil and paper ready. So it's Andrea.Spiegelmoyer@mercyhealth.com.
Perfect.
And again, my name is Krista Harmon. I'm going to stop sharing real fast here. I didn't mean to hit it that fast. So yeah, as we finish, what do you think, Andrea? Final word of wisdom.
Get out there and do it. If this is where your heart is at, I commend you, because a lot of people can't handle this. Give it a go. There's nothing wrong with trying something and finding out it's not for you. Don't sit there and let that question just linger in the back of your head. Now, this is advice for anything in life, really. Just get out there and try it. You have to try something to really know if it's going to work for you, and you'll be pleasantly surprised in some parts of your life if you just try it. Well, thank you, everyone.